Let's talk about OCDs, obsessive compulsive disorders. This is a word which is given for a particular behavior of yours. And some of the behaviors they're considered abnormal, and some of the behaviors are considered normal as per different definitions given by different people. Any behavior pattern which you repeat and you feel comfortable, I call that as obsessive compulsive disorder. Supposing you put on glasses and then every few minutes you have a tendency to do this to your glasses. And when you're talking, you just do this again. This is also some kind of obsessive compulsive disorder. But this comes across as your mannerism. But just see, if somebody tells you not to do this, please don't touch your glasses over and over when you're talking to me. You will be very uneasy, and to the point that you might forget what to talk. And there are other obsessive compulsive disorders which are looked down upon. Supposing you get in the habit of washing hands over and over. Post-COVID, many people got into this habit of compulsively washing their hands, fearing that there shouldn't be any germs or virus which can spread and can cause disease. Then this tendency also keep on increasing to the point that you just clean once, twice, and then you clean with the antiseptic or antibacterial sprays. And then also you want others to wash their hands too. And if they have not washed their hands, then you're very uneasy in their presence. So any behavior pattern without which you cannot live is kind of an obsessive compulsive disorder. Watching TV, and if you do not watch TV for X number of hours, then you are not comfortable in your own skin. And then other mannerisms which you have made, that I have to drink water with food. If I don't drink it, then I can't eat. Or I have to watch TV while eating food. Or I can eat only this kind of food and not that kind of food. I cannot have ginger in my food. And so these are different habits which are your attitudes, which you cannot bypass or you cannot control. And any attitude, how small it may be or how big it may become, is a hindrance, is a barrier for you to experience the present time. And a person is in present time and does not understand that the present time brings all the beauty and wealth of existence. But then it is trying to avoid the present time. Once you experience present time without all these OCDs or dependencies or crutches of your behavior, you will see how enriching it is. But it is like, which comes first kind of question. And in order to get rid of these compulsive behaviors of yours, which you might consider as your mannerism, or this is your style, or you can call it as OCD, and then sometimes people show their OCDs as if that is some kind of status symbol they have. If you come across such mannerisms of yours, and then when they appear and you overcome them, I'm telling you, it is a little struggle, but you are the best person to control them by just observing them and sitting through them. One by one, you shed more and more mannerisms and attitudes and compulsiveness of yours and gain more of you. Gain yourself back and then feel the presence. The point over here is OCDs are not something which are medically diagnosable and something which is completely, noticeable thing which others can notice. And then they say, hey, what are you doing? Like, some twitches you do, you just twitch your eye, you just keep on breathing like this. And then that becomes very noticeable. And then people say this is kind of an OCD, but you yourself notice your mannerisms and behaviors and attitudes, which you say that this is who I am. And they are also barriers or OCDs, obsessive compulsive disorders, or stubbornly held attitudes, which do not let you experience the existence and the wow of now. Wow of now. I like it. So we'll continue discussing more.